you have a scar that is tight, painful, itchy, raised, or causes issues with mobility or movement, you could benefit from doing a scar massage. In just a couple minutes a day, scar massage can really help to reduce your pain, improve the appearance, and if you have a newer scar, help it heal better. In this video, I'm going to show you how to do it safely and effectively. I'm Dr. Alex Hill. I'm your physical therapist for everything pelvic health and oncology. Let's work on that scar. Scar tissue is a normal part of the body's healing process, and it forms when there's damage to tissues or skin that requires repair. This could be from after a surgery or an injury. Often scars don't cause any issues, but sometimes they can cause a lot of problems, and that can include things like pain and trouble with mobility and movement. So, for example, if you have a lower abdominal scar, like from a hysterectomy or a C-section, that scar tissue could cause discomfort with wearing underwear or pants, bladder issues, or trouble with mobility like bending forward or extending back. But this is where massage for the scar comes in. In general, most people can start 2 to 4 weeks after surgery, but always confirm with your surgeon and your medical team first. Getting started on scar massage early in the healing process can really help it heal better. Before you begin doing scar massage, there are a few important safety tips to keep in mind. You only want to do scar massage after you've been cleared by your surgeon or your medical team. Your scars should be fully closed, so avoid massaging over any open areas or if there are signs of infection. You want to use gentle pressure, especially if the scar is new or it's very sensitive. And remember that a little discomfort is normal and that's to be expected, but you shouldn't have any pain with this scar massage, or if the pain starts getting worse and it doesn't get better, stop doing the massage. All right, so let's go through the scar massage steps. I'm going to be demonstrating each one as we go. Step 1 is going to be washing your hands, which will help to reduce the risk of infection. And then you're going to use a massage cream or oil. And there's mixed research on what is the best thing to use for scar massage, but really the goal is to hydrate the skin and reduce friction while massaging. So find something that works for you, like vitamin E oil, cocoa butter, or an unscented lotion. All right, so now we're gonna be going through a couple different scar massage techniques. If you have a lot of sensitivity around the scar, then you should start with just very lightly sweeping your hand along the scar and along the skin around the scar. You can also use soft materials like a cotton pad or a really soft t-shirt. That can help with decreasing some of that sensitivity that can happen after a surgery or an injury. If it's early on in the healing process, you're going to want to start with massaging around the scar first. You're not going to be working directly on the scar, and this is going to just start to help to move some of those tissues around the scar, especially again in that early healing process, so in those first couple weeks after the surgery. And you're starting again away from that scar, and you can do circular movements, you can do them clockwise, counterclockwise, but we're just starting to get some movement around that scar. You can do that for a couple minutes around the scar just to start with. Once you're cleared by your surgeon or medical team to actually start working on the scar, then you're going to just gently with the pads of your fingers do some scar massage along the scar, and you're going to just start with small movements first. You don't want to be going into really big movements along the scar when you're first starting out. And you want to move just enough that you can feel that skin and the tissues move underneath your fingers. You do not need to be aggressive with this. As you do this scar massage, you can spend about a minute at each area of the scar. You don't want to spend more than a minute at a time when you're working on the scar. After you work along the scar, then you're going to then go perpendicular to the scar. So you're going to be moving it up and down. And again, you're just going to work your way along that scar. And again, you can spend up to a minute on each of those areas, but you don't want to spend more time than that. Early on, as that scar is starting to heal, you're going to want to start with a lighter, smaller pressure, but as that scar starts to heal, then you can really start to get into bigger movements and deeper pressure with it. After you do along the scar and perpendicular to the scar, then you can do circles. So you're going to start on one end of the scar, and you can even go a little bit beyond the end of the scar. Oftentimes that scar tissue goes beyond what you can actually see on the surface of the skin. So you're going to do those circles, and again, early on, start with smaller movements, lighter movements, and you're just going to work your way along that scar. And you can spend a couple minutes again on doing the scar massage, but no more than a minute at each area of the scar. And with this one, I just did counterclockwise, and then you can work your way going back the other direction, and you can do that then clockwise. As we do this massage, this helps with the healing process, brings blood flow into the area, and it helps all of that collagen and fibrinogen, all of those cells really start to heal well and lie flat. Now, that's the first part of doing the scar massage. So we have the desensitization around the scar, including with the cotton pad if you need it. We have massaging around the scar first, moving along the scar, perpendicular to the scar. We've got the circles along the scar. Now, once that scar has started to heal much more and you're able to get into more pressure with it, we're going to do something called bending. So you can grab above and below the scar, and you're going to bend it with one finger above and below, or you can do two fingers above and below, and you're just going to bend that scar. Early on, this is typically going to be a little too intense to do, but again, as that scar starts to mature, or if you do have an older scar, then this bending technique can be really helpful. And again, you're just going to bend along that scar and work your way along the length of that scar, getting some more mobility with it. And again, as you're massaging it, you should be able to feel that you're able to get into deeper, bigger movements with it. And then finally, the last thing you can do is actually picking up the scar. So you're gonna come from around the scar, come down into this tissue, kind of pinch in and lift up. So you're just kind of pinching and lifting that scar. And this, again, is going to be a little bit more of an advanced technique. So once your scar is more fully healed, then you can start doing the bending and this one where you're kind of lifting and picking it up. These can be, again, a little bit more intense. So you don't want to do this if you're already having a lot of sensitivity with the scar. Again, you're just picking up and lifting it and starting to get that scar tissue mobilized. At the end, you can then finish with just some light massage, because typically after doing the deeper scar work, that can cause a little bit of inflammation or swelling. So just doing some light massage around it can help with reducing some of that sensitivity or some of that increased swelling or inflammation. Aim for about 5 minutes twice per day as you do the massage. As the scar continues to heal, you can gradually give more pressure to your massage. Some studies suggest that you should continue doing this routine for about 6 months, then reducing to once per day, several times per week until that scar has fully matured. But keep in mind that the scar can take 12 to 18 months to fully mature. You can also use adhesive silicone on your scar, which helps to soften the tissue and can be a total game changer. Gradually build up the time that you're using the silicone to make sure that you don't have any type of skin irritation. Every scar and every body heals differently, but taking a few minutes each day to massage your scar can make a big difference in how it feels and functions and heals. You can also pair the scar massage with some healing movements to get that scar and the surrounding tissues to move better. Check out my video that guides you step by step through a gentle scar mobility routine. If you found this video helpful, please like that button, subscribe for more health tips, and share this video with someone who needs it.